Just a couple more folks. Okay. So you can see on our agenda today a couple new things, couple things that we're going to just continue to review. I'm going to start with vaccines, again, as always, just to kind of keep you up to date on what's going on. And there isn't a whole lot to update you on in terms of vaccines at this moment, but I am going to go back to our vaccine webpage and just show you a couple things again on there. Okay, so just a reminder that our vaccine webpage has tons of resources, and so this green box right now shows you what groups are currently prioritized to be able to get their vaccine. Those 75 and older, protective service occupations, education and child care providers, which includes you all, people 70 years and older, and then coming up this week is individuals 65 years and older. So that's currently where we're at. And again, if you have not registered yet, you can do that on our website here by clicking on Make Your Appointment for Childcare Workers. And just one note about this right now, you might have seen this in the news or various other sources, that we just do not have enough vaccine at this point. And so if you're feeling like it's taking a really long time, if you've already registered on our website and you've just been patiently waiting, the waiting might continue just a bit longer. So until we get more vaccine, we're just not able to open up more appointment slots. So we really want to make sure that individuals who've gotten their first dose have the ability to get their second dose. And so we need to make sure we have enough vaccine for those second doses, which might mean a slight delay in getting new appointments for first doses. So again, we know that this can be extremely frustrating, and it's just been kind of a process for a lot of folks. So if you are still waiting, unfortunately, it just might be a bit of a wait still. So just know that, we're doing the best that we can on our end, but without additional vaccine, there's only so much we can do. So just hang tight if you can. I'll put this link in the chat box again. This is just another really good resource for you if you're wondering what's going on in the world of vaccines. So that is in the chat box. Again, you can also find our frequently asked questions from this page, and this is updated really frequently, and there's tons and tons of really good information in here. So I can't guarantee it, but a lot of questions you might have can probably be answered by coming to our frequently asked questions page. Okay, so the other little update I had is we got an ask from some of you all that you'd like something that you can print out and post at your centers or share with your staff and family and friends that just has some basic information about the vaccine. So you ask and you shall receive. So this has been created in English and Spanish. I will drop the link to both of these in the chat box in just a minute, and then either later this afternoon or first thing tomorrow, I'll also send out a mass email to everyone that has both of these included as a PDF. But it has just some basic information, what you need to know, why getting a vaccine might be a good idea, a quick little blurb about safety, side effects, how well does the vaccine work, it's free, which is super important, and why do I need 2 doses. So again, we have this guy in English and Spanish, and let me just share them both with you now. Whoops, there, oh gosh. So slow. Give me just one second here. Okay, so that one is for the English version, and then I will send you the link for the Spanish as well. And again, just one more time, I will be emailing these as a PDF. Okay. So I'll just pause here for a moment. Does anyone have any questions about vaccine before we move on? Because I do want to spend the bulk of our time today talking about mitigation strategies. So, we're into the vaccinations, which is great. We want all of you to get vaccinated, but in the meantime, we do still need to keep up with our mitigation strategies. So that's really what I want to cover today. So any questions right now about vaccines? Or Brian, if you have anything else that you want to share about vaccines before I move on.
No, this is Brian. I think you covered everything pretty well, Rebecca. Note that the U of A is going to be a state-run pod starting on the 18th. So in order to register to receive your vaccinations at the U of A, if you haven't gotten your first dose, you'll need to actually register through the ADHS website, which you can just Google ADHS vaccine pod, and it'll take you to that link. So just one additional layer to consider. And the three options that you'll now have is a 1B qualified personnel to receive the vaccine.
Thanks, Brian. And before, oh, we got a hand. Go ahead. Feel free to unmute yourself and ask your question, Amelia.
Hi, Rebecca. Thank you so much. Quick question, because I know the CDC updated their recommendations for quarantine people who have been fully vaccinated 2 weeks past their second vaccination. So, for example, if one of them gets, it's within their household or somewhere where they're outside of the classroom or even in the classroom, have you guys discussed that? Are there recommendations for that? Because it's a little confusing and a new thing, so I'm trying to navigate that.
Oh, yeah, and I apologize. I've not been keeping up quite as much as I should. Brian, can you point me in the right direction on the website I can share?
Yeah, we actually have some documentation that we're developing through our communications team right now in relation to this issue. The big thing that we're pushing out with that is pretty much what you cited, Ms. Morales-Baum, is that when you get the second dose, there's a 14-day period where you still will need to quarantine if you're in close contact or if you're symptomatic. After that 14-day period is completed, there's I want to say it's like 60 or 90-day efficacy where you're exempt from quarantine or isolation, which would just be quarantine because you wouldn't have to isolate. You have your full vaccination. So those aren't the exact numbers. I actually need to pull up the days on that for the full efficacy of it. But that's there was the new guidance that was released on that, and we do have communications that are being developed in relation to that. I'll see if I can dig that out while you keep going through all this, Rebecca.
Thank you. I apologize. I didn't have that up. And before I get too far ahead of myself, because I'm looking at her now on my screen, I just wanted to introduce our new team member, Christina Hyde. Give a little wave. That's Christina. She's joining our education liaison team. She's going to be helping out specifically with you all as a child care liaison. So as we move forward over the next few weeks, you'll probably be hearing from her a lot more and maybe a little bit less of me. So if you're shooting us an email and you have questions, or you're reporting a positive case, or you're jumping on these webinars, you will likely see a lot more of Christina. So just keep an eye out. We're super happy to have her, and I just wanted to welcome her to the team so you all can see her face and say hello. Okay, so we are going to keep rolling here, and we're going to talk about some mitigation strategies. And also a thank you to Christina for putting together this PowerPoint slide that I'm about to share. And I will also email this PowerPoint slide out to you all along with those informational handouts that I shared. So don't feel like you have to take a ton of notes here. And there is a lot of text on the slides. So again, you'll be getting these, so you don't need to stress about that. But you know what? I'm going to do one thing first. I'm going to show you how to get to this information on CDC's website as well. 1 second. So, okay. I'm going to drop this link in the chat box as well, but CDC has kind of updated their school and child care program information on their website, and there is a ton of really good resources on here right now. So I'm going to give you guys the link to this. There we go. And yes, thank you, Brian. He put in some really good information as well. So this CDC page, if you are also working with K through 12 students, there's a lot of really good info in here. So I just wanted you to see this page. And I know in our last call, someone, I apologize, can't remember who, had said that CDC had some really good infographics at one point, kind of walking you through what to do in each sort of scenario. So if someone becomes sick in their classroom, what do you do? If someone's showing signs and symptoms, what do you do? And so information that I believe is exactly what you were referring to is on their website here. So I just wanted to alert you guys to these quick guides. These are, specific for teachers, but teachers in childcare settings versus teachers in K through 12, these are really applicable in both situations. So just know that these are available. I would love for you guys to utilize these as much as you can. They're really helpful. So again, that link I just dropped will take you to these. You just have to scroll down the page a little bit, and they're right here. And then there's also some other ones that you can print and use. And then what I want to show you today is here. If you click on childcare programs, there's a bunch of information on this page, and we've put that into a PowerPoint slide, which is what we're going to go through now, and which is what you'll receive in an email later today or tomorrow. So we're just going to go through some of these mitigation strategies just as a reminder. If it's been a while since you've kind of looked at some of these things for your facility, or if you just haven't thought about some of these things at all, we're going to just dive into them. And I'm not going to read all this verbatim. I just kind of want to gloss over some of it. But some things that you all can do as staff. The biggest one, right? Wash your hands often with soap and water, or use hand sanitizer with at least 60% alcohol. When it comes to hand sanitizer with kiddos, you definitely want to supervise them. Using soap and water is the best option if you can. If there's not a sink available, hand sanitizer is okay. You just need to watch them to make sure they don't swallow it. Cleaning and disinfecting frequently touched surfaces, so that is your door handles, desks, phones, pens, those kinds of things. Covering your mouth and nose with a mask, especially to cover coughs and sneezes. And we've talked about this quite a bit, but definitely do not put masks on babies and children under the age of 2. And then lastly, if possible, consider having administrative staff telework from home if they can. So staff that are not needed in the facility, consider having them work from home. And I'm not going to put this in presentation mode just because this way I can still see the chat box. So hopefully you guys can still see this okay. When it comes to sick staff and children, these are just some basic guidelines on some things that you can do. First and foremost, require anyone who's sick to stay home. So if anyone is having any kind of COVID-like symptoms or symptoms in general, we don't want anyone spreading anything, cold, flu, whatever it might be, have them stay home. And communicate this to your parents as best you can, how important this is. And we know this is hard. Parents need to go to work, and they need to have someone watch their kiddos. But if they're feeling ill, they need to stay home. Symptom monitoring is another one, so communicate that to your coworkers and staff and parents as best you can. Establish procedures to ensure children and staff who come to the child care center sick or become sick are sent home as soon as possible. So if in the middle of the day someone is feeling ill, don't let them finish out the day. Ask them to go home as soon as they can. And sick staff members should not
Hey everyone, if you'll please excuse us, we just had a power outage at the health department. We're getting back online here in a moment, so Rebecca will join back up shortly. Apologies for the inconvenience.
girls and those types of programs and YMCAs and family strength with those, as well as other community.
Hello, we're back. Someone want to give me a thumbs up if you can hear me? Yes, thank you, Dixie. Okay, sorry, the power just completely went out in our building. So, oh boy. All right, so let me go back to our PowerPoint and see where we left off.
Oh.
It's never a dull day over here, you guys. Okay.
It's back up.
Here we go.
Here we go.
Okay, so let's keep moving here. So staff or children that are sick at your center, here's just a couple suggestions for you all. If you have a room that you're able to use as an isolation room, so if a sick child comes down with symptoms, for example, if you can isolate them away in another room until parents or guardians can come pick them up, that's just something to consider. And then again, clean and disinfect all surfaces after the sick child has gone home. So one more reminder to mute yourselves, guys, if you have not done so. Thank you.
Rebecca?
And then if COVID-19 is confirmed in a child or staff member, what do you do? Close off areas used by the person who is sick. Open outside doors and windows to increase air circulation in the areas. Wait up to 24 hours or as long as possible before you clean or disinfect. So this just allows respiratory droplets to settle before you're in there, potentially breathing them in to clean and disinfect. If more than 7 days have passed since the person who is sick visited or used the facility, additional cleaning and disinfection is not necessary. Okay. So these are some social distancing strategies. So we know that 6-foot distance really does help when it comes to mitigating COVID. And if you remember when we were talking about, thank you, Linda, recording is turned off. I will start it again. No, actually, it looks like we're still recording. So I think I'm okay. When we talk about what a close contact is, it's someone who's within 6 feet for more than 15 minutes. So the more that we can spread individuals out so they are more than 6 feet apart, the less likely you're going to have individuals as a close contact if someone does get sick. So some things that you can do, and I know these are hard, and it really depends on the size of your facility and just sort of what resources you have available, but as best you can, childcare classes should include the same group each day, and the same providers should remain with the same group each day. So I know that's tough, but if possible, to try and keep groups in cohorts. So rather than having one staff member kind of bounce around between different classrooms throughout the day, if you can keep them with one group of kids throughout the day, that's really going to help. So again, if that staff person does get COVID and they've been in 4 rooms versus 1, you're going to have a lot more potential exposures. Cancel or postpone special events such as festivals, holiday events, and special performances, which are all the fun things we know, but the more we can limit some of those things right now, the better off we're going to be. And consider halting daily group activities that may promote transmission. So again, keeping kids in separate rooms, limiting the mixing of children, so not having them bounce around between different rooms, staggering playground times if you can, and if possible at nap time, ensure that children's mats or cribs are spaced out as much as possible, ideally 6 feet apart. And if they are, on mats, consider head to toe so that they're not face to face. Okay, drop-off check-in procedures. Again, I'm not going to go through all of these, but really just think about ways that you can limit the amount of exposure between parents and kids and staff. So if you're going to do curbside pickoff, limit the drop-off and pickup, Limit direct contact between folks as best you can. If there's a sink or a hand hygiene station that you can set up when people walk in, so they can wash their hands when they enter, that's a good thing to do. You can put sign-in stations outside, so you have less people kind of congregating indoors. Childcare providers, you can greet the children outside as they arrive so that parents or guardians don't need to come inside to drop them off. This is a hard one too, but just things to think about. Designating one parent to be the drop-off pickup person. Infants could be transported in their car seats. And then this is, this one's really important too, is if someone is older or immunocompromised or they have other underlying health conditions, consider recommending that those people are not responsible for drop-off and pickup. We want to have those people home and safe as much as they can. Other things that you can do are screen children upon arrival, and this can be just as simple as a visual inspection to see if they look ill, if their cheeks are flushed, they're having rapid breathing or difficulty breathing, fatigue, extreme fussiness. These are all signs that they might not be feeling well. You can also do temperature screenings, and there's some information on how to do that below. I'll let you guys read that on your own. Cleaning and disinfecting. So we talked a little bit about this already, but facilities should develop a schedule for cleaning and disinfecting if you haven't already done so. Routinely clean, sanitize, and disinfect surfaces and objects that are frequently touched. So this is things like toys, games, desks, doorknobs, handles, things in the bathroom. And this may include objects and surfaces not ordinarily cleaned daily, things like light switches or classroom sink handles. Make sure, of course, you're following directions on the cleaning product labels. And cleaning products, of course, should not be used near children and staff. So, if you are using some of those stronger chemicals, to make sure that you have adequate ventilation, open up the windows and doors. Especially, if kids have asthma or other respiratory conditions, some of those cleaning products could potentially be a trigger. So just be mindful of that. And on the same vein here, clean and sanitize toys. So toys that cannot be cleaned and sanitized for whatever reason, definitely consider removing those from the room so that it just doesn't become an issue. Toys that children routinely place in their mouths or otherwise contaminated by body secretions should be set aside until they can be cleaned. Machine washable toys should be used by one individual at a time or should not be used at all. So that would be things like plush toys, stuffed animals. And then kind of keeping in line with the cohorting, which is keeping staff and children in one classroom as best you can, do the same with toys as well. So we don't want to have those toys moving between classrooms if you can. And then toys that do need to be cleaned, you can set those aside in a dishpan or a bucket with soapy water and, sort of mark that those toys need to be cleaned so that they're out of the rotation, if you will. Diapering. So we've got, when you get this PowerPoint slide, you can click on this proper diapering procedure if that's something that you need. But really the important thing here, and I'm sure you all know this and are doing this, is washing hands before and after. Even if you're disinfecting the diapering area, make sure you're cleaning before and after. If reusable cloth diapers are used, they should not be rinsed or cleaned at the facility, so put them in a bag. And they can be taken with the parent and be cleaned at a later time, laundered somewhere else. Washing, feeding, or holding a child. And this just gives some strategies, if you will, for trying to reduce any kind of infection that might occur when washing, feeding, or holding a child. So it includes, wearing a large button-down shirt, putting your hair up, making sure that you're washing your hands, neck, and anywhere else that's touched by any secretions, changing clothes if needed, if those are soiled at any point. Contaminated clothes can be placed in a plastic bag and taken with them. So, you can encourage parents to have bring an extra change of clothes for their kiddos if they need to. And again, washing hands before and after handling infant bottles that have been prepared at home or in the facility. More healthy hand hygiene behavior, and these are the times that the CDC and we do as well recommend that hand washing does happen. when they, arrive at the facility and after breaks, before and after preparing food or drinks, before and after eating or handling food, before and after administering medication, before and after diapering, after using the bathroom or helping a child use the bathroom, after coming in contact with bodily fluid. So if a child sneezes, coughs, those kinds of things, hand washing, after playing outdoors or in the sand, or handling garbage. And so the recommendation for basic hand washing is to wash for at least 20 seconds with warm soapy water. Food preparation and meal service. So if you are serving meals in your center, consider doing them, in a classroom if they're in specific classrooms, rather than having everybody kind of congregate in one cafeteria style or kitchen if you have something like that. Try plating each child's meal individually instead of doing sort of a family style. That way the utensils aren't being shared. And I can imagine this can be hard if you have a smaller staff. Food preparation should not be done by the same staff who diaper children. That's probably really hard, and we completely understand that. So again, just lots of hand washing. Sinks used for food preparation should not be used for any other purposes. I know that one's tough as well, but you probably don't want to be washing any soiled, dirty toys, for example, maybe in the same sink where you're preparing a meal. And then, yep, lots of hand washing before and after meals. So the last one here is vulnerable high-risk groups. Again, this might be common knowledge for a lot of you right now, but older adults or people of any age who have serious underlying medical conditions we do know might be at higher risk for COVID-19. So if you have staff members who are over the age of 65 or they have underlying health conditions, encourage them to talk to their healthcare provider to assess their risk. Again, if they're over the age of 70 right now, they can get vaccinated. Over the age of 65 is happening this week. You all are child care providers anyways, which means you're eligible to get vaccinated. So, if you do have older staff or they have underlying conditions, I'd really recommend as best you can to try and encourage them to get vaccinated. Okay, and then there's just a little blurb there about children getting COVID, and generally it does seem children seem to get COVID a little bit less, and they do seem to have less severe reaction, but there is a small percentage of children that have had more severe illness. So if there's children at your site that have underlying health conditions, you might want to consider talking to their parents and having them speak to their child's pediatrician as well. Okay, so I ran through that all pretty quickly just because we are going to send this to you, and I'd like for you guys to, take your time looking through this. And then again, I'll show you the website on CDC where you can find all this information as well. So I sent you the link for this page here, and then if you just click on child care programs, that will take you basically verbatim to the information we shared in the PowerPoint slide. So I'm going to pause here for a moment, mostly because I need a drink of water, but also if you guys have questions, I can take some of those now about any of the mitigation strategies we discussed. Okay, I am hearing none right now. So I'm going to show you, again, just a review of a couple other things. It's been a couple of weeks since we've covered some of this stuff. So I want to go back and show you guys again our Back to School and Childcare webpage. And I will put this link in the chat box as well. But if you go to our pima.gov website, on the right-hand side over here, there's a link for Back to School. You can click on that and it'll take you to the page that we're on now. We do update this page regularly, so the information that's on here is up to date. But a couple things I want to point out again. There's a link directly here to Pima County testing centers, so if you have any staff or students who are feeling ill and they want to get tested, they can go here and it tells you everything you need to know about the testing centers and how to contact them. And this one, I really want to make a point. We have a lot of downloadable and printable signage that you guys can use That's in addition to the things I showed you here on CDC's website. In addition to these, we also have a lot of downloadable signage. So everything from masks required to enter, how to wash your hands, if you guys want to put those up in the restrooms. If you're doing temperatures or wellness checks when people enter, you can put one of these up. So you guys are welcome to download these and print these at any time. If you are unable to print, you just shoot me an email and we can get you some. So I want you guys to have access to these. So if you're not able to print or do those on your own, just let me know and we'll get them to you. Okay. So the other thing I want to remind everybody of is how to report positive cases to us, and also a reminder that based on this emergency measure, which comes from Arizona Department of Health Services, you all are required as child care providers to report 2 or more laboratory confirmed COVID cases to the health department, us, within a 14-day period. So if 2 or more positive cases pop up between staff, yourself, children at your facility, 2 or more positive cases within a 14-day period, that's what we consider an outbreak, and outbreaks do need to be reported to the health department. And these are individuals who are epidemiologically linked, so essentially meaning they do not share a household. So if you have a brother and sister who both come down with COVID within a 14-day period, that wouldn't be considered an outbreak. But if you have let's say a 3-year-old and a staff member who was working in that same classroom, and they both come down with COVID within a 14-day period, that is what we would consider an outbreak, and that does need to be reported to us. So I'm going to walk through just really quickly again how to do that. So on our website, if you just click Child Care Providers Report a Case, this information will notify our Child Care Liaison team that you have positive cases to report to us. So this information we need here is just whoever's reporting to us. We need your first and last name, email, phone, the name of where you work, and in the message, you just need to put down the number of positive cases. If it's 2, if it's 3, if it's 4, and that's all you need to do. Once you submit that, one of our team members will give you a call back to get information on the positive individuals. So in this box, you don't need to put any identifying information. We don't want that at this point. This is not a HIPAA compliant website, which is why we take information on the cases over the phone. So that's just a reminder. We haven't had a lot of positive cases to us reported lately, which in theory is great. We do seem to have numbers kind of on the downward trend in Pima County, which is awesome. But transmission is still high, and so I just want to remind folks that reporting is something that you do still need to do if you have 2 or more positive cases. You can report just one case to us. If, for example, you just want some guidance, you just kind of want to know, well, I've got a positive case, what should I do now? You can certainly call us at any time if that's the case, if you just want to figure out kind of next steps. But based on this emergency measure, it is 2 or more cases that we need to know about. Okay, so any questions about reporting? Nothing? All right. I'm just that clear today, huh? Okay. So I only have really one other thing on the agenda that I want to share with you, and this comes from a colleague. So I'm going to pull up an email if I can. Give me 1 second. Okay. So you guys are looking at an email that I got from a coworker, but this, I just wanted to bring your attention to a Board of Supervisors agenda item for this week, which is about early childhood program scholarships. So the Board of Supervisors are moving to approve a measure which will direct the county to include $10 million in the Pima County budget for fiscal year 2021-22 to fund scholarships either in full or partially for parents who wish to enroll their 3 or 4-year-old children and 5-year-old that aren't in kindergarten in a high-quality early childhood program. So there's some additional information here about criteria and those kinds of things. But I'm just trying to read here. Yeah, so just know that there are some scholarship opportunities that will be budgeted for in the Pima County budget. It looks like there's going to be 3 types of scholarships that are offered. One for school districts and other providers that can add complete new high quality classrooms, so improving capacity for child care centers in school districts. The second one is scholarships to existing high-quality providers to address existing need. And the third is scholarships or sponsorships to the 36 or more providers on the waiting list for quality first assessment, rating, and coaching for 3 years or more. So I just wanted to share this with all of you. If you have questions about these scholarships in particular, I can put you in contact with a colleague who shared this with me, so they have a lot more information about this than I do, but I did just want to share it all with you while I had the time today. So that is everything I had for today. Again, this meeting has been recorded, and we will share it on our YouTube page when it is up. And I will put the YouTube link in the chat box one more time for you guys. The previous webinars are already up here. So if someone on your team has missed them, or if you want to go back and review something, they're here. So I'm going to stop talking now. Does anybody have any questions for us before we jump off today? Okay, we got a quiet group today. We got a hand raised. Rachel, go for it.
Hi, I had sent you an email, but I was just wondering, are there going to be any changes to the close contact to include PPE, like use of PPE at all?
That's a good question. And so I did ask Brian, who you hear from on these calls as well, to see if we've been having some conversations internally about that. I hadn't heard anything yet, but he said that there are some conversations happening, and they're kind of looking at some options for that. So right now we're still kind of in research mode, trying to figure out if that is an avenue we're going to go down in terms of potentially amending what we define a close contact as based on PPE. So for example, in your email, like you mentioned, Rachel, if someone's double masking and one of those is an N95 mask, would that potentially excuse someone, if you will, from being a close contact if they have certain PPE on? So Rachel, we are looking into it, but we haven't made a determination on that yet.
Okay, perfect. And then the other question I had is kind of a interesting case, but so for TB testing, obviously all of our employees have to get a TB skin test prior to employment. Mm-hmm. And right now the recommendation is to delay. So if they've gotten the vaccine within 4 weeks, they want you to delay that. But state is still requiring that. And I haven't had a conversation with state. So I just was wondering, because right now they have proven that if it's positive, it's positive. So there isn't a high false positive rate, but they aren't sure if it could cause a false negative. So I was just wondering if there has been any conversations around this in regards to the COVID vaccine and the TB skin test.
Oh, wow. Good question. I've not heard that question yet, and that hasn't been brought to my attention, but I will definitely ask, because that one's new to me, so I'll ask around. I'm not sure if Diane or Brian or anyone else is on has an answer, but I do not.
Okay, I can send you the data set from that describes it all about the false. There's no data supporting the false negative too, if that's helpful document for you. So
absolutely, that would be really helpful.
Rachel, that's a really great question. And so I think it's something we should look at. So thank you for bringing it up.
Okay, for anyone that doesn't have any other questions, you're more than welcome to jump off, and we'll be back on the March 3rd, which is unbelievable that we're going to be in March soon. So if you don't have any other questions, I will see you March 3rd. Otherwise, I'll stick around for another 10 minutes or so if anyone has anything else they'd like to discuss. All right, does anybody have any last minute questions for me? I don't want to take up too much of your time if you guys are just hanging on waiting for any other questions. It doesn't seem like we have any other ones. Linda, go for it. Linda, you are muted if you're talking.
Rebecca, I'm sorry, I forgot to unmute. Do you know what the recommendations are right now in terms of pregnant women taking the COVID vaccine? I know this is not directly childcare related, and I know there's not been the research, they're not been in the clinical trials, but, you know, just asking in case, you know, someone wants to know. People sometimes ask that question.
Yeah, that's a really good question, and it is on our frequently asked questions page, but you're right, Linda, they weren't included in the clinical trial, and so there just isn't a lot of information right now for that particular group. And that's exactly what our frequently asked questions answer is. The safety and efficacy for pregnant women will be determined at a later date. So I would definitely just encourage anyone who is pregnant and wondering about the vaccine, they can always ask their provider, their OB, their primary care provider, what they think. But for right now, we just don't know.
Okay, that's what I thought. So I'll continue to give the same answer. Okay, well,
Yeah,
that's
thanks,
all.
Linda.
Yeah, that's all for me today. And thanks very much. As always, I always learn new things, and I enjoy coming to these updates because, first of all, you know, we talk in general about vaccines and everything. So that gives me a lot of answers to try to give to the community and other people that are trying to find how to register, where are the vaccines given,
Absolutely.
you know, am I old enough? Is the 65-year-olds getting theirs yet? You know, so it's good to just get it from you all.
For
Okay.
sure. Thanks, Linda.
All right, thanks a lot. And Diane, thank you. Talk to you all later. Bye. Bye.
All right, guys. I think that's it for today. We'll see you all in 2 weeks. And as always, if you have any questions, just shoot me an email, give me a call, however you can reach me, carrier, pigeon, we'll find a way.
Okay.
All right, have a good day, everybody.
Okay, bye.